Okay, I think we've got a good number of folks dialed back in, so if you don't mind, we're just going to start again. So with that,
Okay.
I will turn it over to you.
Sure. Welcome everyone, and so sorry for all the technical difficulties. I'll try to be really quick. Again, my name is Aruna Jasti, and also joining me on the call today are other CMS experts and contractors who will share helpful information on the call today. Today's call will only focus on quality reporting. You can contact the Quality Payment Program Service Center with any of your questions regarding cost, promoting interoperability, improvement activities, MIPS, or quality reporting in general. Next slide, please. This is the disclaimer slide, and I will skip this slide for now. Next slide, please. A few quick announcements. The submission period for the CMS Web Interface aligns with other submission types for 2019, opening on January 2nd, 2020, and closing at 8 p.m. Eastern Daylight Time on March 31st, 2020. Your submission will be automatically accepted at submission close. As a reminder, the CMS Web Interface is accessible using the sign-in link on the Quality Payment Program website, which is also circled here on the slide. We encourage you to submit your 2019 MIPS performance period data in advance of the submission deadline of March 31st. Early submission will provide you with time to receive assistance from the QPP Service Center and also have other CMS approved requests reviewed and complete the CMS Web Interface reporting requirements. Next slide, please. As you already know, today is a part of a series of Web Interface support calls held weekly through the data submission period. The next support call will be held next Wednesday, March 26, 2020 from 1 to 2 p.m. Eastern Daylight Time. Next slide, please. The other CMS approved reasons skip requests must be submitted through the CMS Web Interface. This is a way to skip a patient attributed to a measure during denominator confirmation. The CMS approved reason is reserved for circumstances that are unique, unusual, and not covered by any of the denominator exclusions or denominator exceptions identified in the measure specifications. Patients for whom a CMS approved reason is selected will be skipped, and another patient must be reported in their place for the measure if available. We encourage you to submit a 2019 CMS approved reason as soon as possible and no later than Friday, March 20th. Submitting after March 20th may cause your request to not be processed prior to the close of submission. Next slide, please. A quick reminder, the 2019 CMS Web Interface API is available all year for testing in the developer preview environment. You can review the resources listed on this slide for more information. Next slide. And now I'll pass it off to Angie Stevenson to go over the frequently asked measure questions.
Thanks, Aruna. Hi, this is Angie from PIMS. To go over the frequently asked questions for today. The first slide is that it was brought to our attention in last week's support call that the frequently asked questions slide presented on slide 13 for hypertension measure in the January 22nd support call was not consistent with the responses given verbally for support call questions and at the service center with regard to urgent care. So we appreciate having that brought to our attention. The January 22nd webinar materials are going to be updated with the correct information and will be reposted. So the two question and answers below are to clarify the allowable settings for the hypertension measure. Question 1 is, are blood pressure readings from an inpatient setting or an emergency department acceptable? The answer is yes, although the measure is intended to be outpatient. Blood pressure readings from any clinical setting are acceptable when reporting the numerator for the 2019 HTN2 measure. It would be appropriate to move to the next most recent blood pressure in the measurement period if the most recent is from an inpatient or emergency department visit and is not within normal parameters. Question 2 is, are blood pressure readings taken at an urgent care visit acceptable, or can we use the next most recent? And the answer is, if a blood pressure reading from an urgent care setting is the most recent in the measurement period, it should be used. Urgent care codes are included in the encounter codes within the HTN coding document. Blood pressure readings taken at those outpatient visits should be included. Next slide, please. This question is regarding confirmation of diagnosis. Excuse me. Are the diagnosis codes in the coding documents for each measure all-inclusive lists, or are we able to use codes that are not within the coding documents? The coding documents are considered all-inclusive when mapping to an EHR. If you are not mapping to an EHR, the coding documents may be used as a guide to assist in reporting. In either case, coding alone is not sufficient documentation. The medical record must substantiate the information reported. You may use any medical record documentation available as long as you can confirm the patient has an appropriate diagnosis as required by the measure. Next slide, please. The next question is for the DM2 measure. If a patient has a diabetes diagnosis on the problem list that is resolved in November 2018, would they be included in the denominator? The answer is yes. The denominator is inclusive of patients with an active diagnosis of diabetes during the measurement period or a history of diabetes during the year prior to the measurement period. Therefore, for submission of 2019 data, it would be appropriate to confirm the diagnosis if found in 2018 or 2019. The next question is for the PREV6 measure. What documentation is required for PREV6? The measure specification states that documentation in the medical record must include both of the following: a note indicating the date the colorectal cancer screening was performed and the results or findings. The specifications require the following for patient-reported screenings: the date, at the very least the year, and type of test, and result finding, or finding. The next question is for PREV12. If a patient is diagnosed with Alzheimer's or dementia, are they qualified to be an exclusion for the PREV12 measure? Patients diagnosed with Alzheimer's or dementia are not denominator exclusions for PREV12, but may qualify as a denominator exception for medical reasons. If there is medical record documentation stating the reason why the patient was not screened for depression or no follow-up plan was recommended for a positive screen due to the patient's functional capacity, the denominator exception may be reported. Next slide, please. These questions are for the MH1 depression remission at 12-month measure. How is the measure assessment period determined? The start date of the measure assessment period is marked by the index date. The index date is the first instance of an elevated PHQ-9 or PHQ-9M greater than 9. It is also associated with a diagnosis of depression or dysthymia between November 1st, 2017 to October 31st, 2018. The measure assessment period is a 10 to 14-month window, that is 12 months plus or minus 60 days, following the index date, during which a follow-up PHQ-9 or PHQ-9M must be administered to determine remission. Scores obtained prior to or after this period are not counted as numerator compliant. Next question is, if a patient is diagnosed with Alzheimer's or dementia, are they qualified to be an exclusion for the MH1 measure? No, patients with only Alzheimer's or dementia are not denominator exclusions for MH1. Applicable denominator exclusions for the measure include patients with a diagnosis of bipolar disorder, patients with a diagnosis of personality disorder, patients with a diagnosis of schizophrenia or psychotic disorder, patients with a diagnosis of pervasive developmental disorder, and patients who were permanent nursing home residents. Thank you, and I will turn it back over to Aruna Jasti at CMS.
Thanks, Angie. Next, we will go over available resources and where you can go for help. Next slide, please. Please note that 2019 materials providing information on the MIPS quality performance category are available on the Quality Payment Program Resource Library. We encourage reviewing these resources if you have questions on quality requirements and measures. Additionally, the help and support page on the QPP website contains links to materials such as videos, webinars, and online courses, as well as other items to help with reporting and development. Next slide, please. The QPP webinar library also contains recordings, slides, and transcripts for past QPP webinars, including the recent 2019 CMS Web Interface user demonstration held in November and the CMS Web Interface kickoff call held last December. The recording, slides, and transcripts for the January and February Web Interface support calls are also available on the library. Next slide, please. Next slide. This slide contains links to resources available for Medicare Shared Savings Program ACOs and the next generation ACO model. We encourage you to review the materials available here and sign up for each newsletter for more information. Next slide, please. If you need additional assistance, please refer to the contact information listed on this slide. Next slide. A quick reminder, if you're interested in providing feedback and collaborating with CMS on the Quality Payment Program, we encourage you to participate in our human-centered design efforts. To get involved, please email your name, title, topic of interest, and organization to qppuseresearch@cms.hhs.gov. And now I'll hand over the presentation to Lisa Marie from CMS for an announcement.
Thank you, Aruna. So I know we received some questions in regard to the submission deadline in relative to the current COVID-19 pandemic. So we will be providing further guidance very, very, very soon. So at this juncture, we're not able to address any of those questions, but as I noted, further guidance is forthcoming very, very soon. So just hold tight and we'll be providing further information. So now I'm going to turn the presentation back actually over to Lauren. Lauren?
Great, thanks, Lisa Marie. All right, so we are now going to start the question and answer portion of this webinar. Again, if you have a question on any of the measures I talked about earlier in this presentation, please feel free to submit it via the chat box on your screen and we can read it out loud, or you can raise your hand to ask a question over the phone line. All right, so your first question concerns PREB 13, and it asks, our hospital-side EMR has a diagnosis code and the automatic description, but is not discussed at that time of service. Can you please confirm that this would not count?
This is Deb from the PIMS team, and I can't confirm that that won't count per se. Basically, you don't have to find something at the date of service. You're just looking for confirmation of that diagnosis based on the denominator criteria of the measure. So if you can confirm using both coding and medical record documentation that the patient is eligible for the denominator, then you can certainly confirm. If you're not sure if what you are looking at is confirmation, then our recommendation is to reach out to the clinician and confirm whether or not what you are seeing is confirmation of the diagnosis. Unfortunately, we can't give you specific direction on what you are seeing because that documentation can be so different. Just be aware that patients are attributed to these measures because there has been something found in claims. So not that you can use those claims and not that that necessarily helps too much, but it should give you kind of an idea that what you are finding in the medical record documentation, if you can find any kind of combination of coding and medical record documentation or medical record documentation that supports that diagnosis, that would be sufficient. Thank you.
Great, thank you. All right, next question asks, can dementia or Alzheimer's be used to exclude a patient from the mental health measure MH1?
Hi, this is Katie from the PIMS team. So the answer is no. Patients with Alzheimer's or dementia are not considered exclusions for MH1. The applicable exclusions listed in the measure specifications are bipolar disorder, personality disorder, schizophrenia or psychotic disorder, pervasive developmental disorder, and patients who are nursing home residents. Thank you.
Great, thank you. All right, next question asks, the measures that have denominator exceptions, can you confirm whether they count in the 248 consecutive beneficiaries and are just taken out of the denominator for performance score calculation? Okay, to repeat that question, it says the measures that have denominator exceptions, can you confirm whether they count in the 248 consecutive beneficiaries and are just taken out of the denominator for performance score calculation?
Would someone from Semantic Bits be able to address that question, please?
Hi, sorry, it's Laura from Semantic Bits. That is correct. So if a denominator exception, they are complete, but they are not part of the denominator calculation.
Great, thank you. All right, next question concerns Prep 7 and asks, is it sufficient to have a note from the physician in the EMR stating that flu vaccine is up to date during the measurement period?
Hi, this is Katie from the PIMS team. So the Prep 7 measure specifications require documentation that's applicable during the appropriate flu season. So we would need to know specifically when the flu shot was given and documented in the medical record. Without a specific date, there's not a way to confirm that it was provided within the appropriate time frame. Thank you.
Great, thank you. All right, as a reminder to everybody on the phone line, if you'd like to ask a question, please submit it through the questions box on your screen for us to read out loud, or you can raise your hand and we will open up the phone line. Just letting you know that option is there. All right, next question asks, can you please clarify the use of coding to confirm diagnoses across the different measures, such as MH1, PREV13, and HTN2, as there seems to be conflicting information around when it is appropriate to use the diagnosis codes from the respective coding documents to confirm diagnoses for the denominator confirmation staff.
Yeah, this is Deb. This was also on the slide deck today, so I'll go ahead and read some information. basically when submitting data through the CMS Web Interface, it is expected for CMS Web Interface reporters to retain supporting medical record documentation demonstrating that the patient met the denominator criteria, the numerator quality action was performed, and/or any applicable denominator exclusions or exceptions existed. Due to the comprehensive and individual nature of patient medical records only available to CMS Web Interface reporters, CMS cannot provide specific feedback regarding whether or not documentation in a patient medical record, including screenshots, would meet the intent of the measure or be sufficient for a given measure in the event of an audit. In the event of an audit, auditors will review measure specifications in comparison to the patient medical record documentation provided by an ACO, MIPS group, or virtual group for each patient sampled for the audit. When it comes to coding, coding alone cannot be used. However, you can use the coding that is provided in the supporting documents to assist in finding medical record documentation. You can use a combination of coding and medical record documentation to confirm. If you have any questions or there's any concerns that what you're seeing, you don't know if it meets or not, that is when you would want to reach back out to the clinician and confirm. Please note that when we do indicate reaching back out, we are not saying reach back out so that medical records can be updated. We are only saying reach back out if you have questions about what you are seeing in the medical record documentation. Thank you.
Great, thank you. All right, and we're getting a few questions on the FAQs that were mentioned in the slide, so please note that I brought that now up on your screen so you see. All right, and your next question asks, there is a code in the chart indicating that the flu vaccine was either refused or not given for medical reasons within the appropriate time frame. However, there is not a further note indicating which of these were the reason. How do you go about this case?
Hi, this is Katie from the PIMS team. So as with all of the measures, in order to report an applicable denominator exclusion or exception, there would need to be documentation in the medical record supporting which exclusion or exception that you're choosing to report. So in this case, if there's no indication of why that flu shot was not administered during the appropriate season, it would be considered performance not met, as you don't have documentation supporting the appropriate reason why. Thank you.
Great, thank you. All right, and we will give it a few more minutes for some questions to roll in. Again, if you have any questions to ask on the line now, please feel free to submit it either through the chat box or raise your hand to open up the phone line. And we'll give it a few minutes. All right, looks like we have a question come in over the phone line by Christina Tomaselli. So Christina will unmute your line. All right, and you may go ahead.
Hi, I just wanted to know what method will you be using to announce that change in the or that update on the COVID-19 potential changes?
This is Lisa Marie. We're just encouraging everyone to ensure that they're registered for QPP listservs. And I don't know if anyone from the PIMS team has the listserv information, so we can provide that in the chat link. So that we want to make sure that everyone is signed up for the QPP listserv. So so Katie, would your team be able to provide that link in the chat?
Yep, we will pull it up and provide it in the chat. Thank you.
Thank you.
Okay, great. All right, your next question asks to please explain the date requirement again regarding Sub 7.
Hi, this is Jamie, and thanks for the follow-up questions. We just want to make sure that this is understood. So for those folks in the in the question box right now that have these questions. Please let us know if you need more clarity, and please don't hesitate to submit a ServiceNow ticket. But we don't need an exact date of that flu shot, but it does, the medical record does need to reflect what flu season that that influenza shot was provided, that vaccination. So hopefully that sort of clears up the follow-up questions we have. And again, if not, don't hesitate to either clarify the question within the question box or submit a ServiceNow help desk ticket. Thanks.
Great, thank you. All right, we have another question come in through the phone line. So Jacques Gabriel, we will unmute your line. And Jacques Gabriel, you may go ahead. Jacques Gabriel, you may go ahead and ask your question.
Hello?
Hi, we can hear you. You may go ahead.
Oh, hi. This question is going back to the Prep 7 that was asked regarding patient refusal. Looking at the coding documents, we have patient refusal as a denominator exception. It doesn't say anywhere where you need to document why the patient refused the vaccine. So are you saying that there has to be documentation on why the patient refused to take the vaccination?
Hi, this is Katie. I just want to clarify. I believe the question asked stated that the chart indicated the flu vaccine was either refused or not given for medical reasons within the appropriate time frame. So in this instance, there wasn't clear documentation as to why the flu vaccine wasn't given. If your medical record documentation supports that it wasn't given due to patient reasons, that's fine. You don't have to elaborate further as the specifications don't allow that. I was just attempting to clarify that it needs to be specific to a reason why that exclusion or exception would be claimed. Thank you.
Great, thank you for that. All right, your next question asks, for Prep 10, is it correct that measure gets skipped if patient is not found to be a smoker?
Hi, this is Jamie with PIMS team. I would not skip that patient if they're found not to be a smoker. That actually meets the intent of that first performance within that numerator, and it would also contribute to your third performance of the measure. So go ahead and allow that patient to respond to that patient within the tool as indicated. I would not skip that patient. You did the screening to figure out whether or not they were using tobacco, so keep that patient within that measure. Thanks.
Great, thank you. All right, next, would a blood pressure reading taken at a podiatry, would a blood pressure reading taken at a podiatry visit be appropriate to use as the most recent reading?
This is Deb. Yes, a podiatry blood pressure reading would be appropriate. Thank you.
Great, thank you. All right, next, can you please clarify the intent of the oversample? As the oversample is included in the performance rate calculation, what effect would the oversample have on the overall quality reporting score?
This is Kristen. The additional sample beneficiaries allow for cases in which some of the beneficiaries may not be eligible for quality reporting. So that's the intent of the oversample. But just to clarify, if additional beneficiaries beyond the consecutively completed 248 are entered and reported on in the web interface, that is included in the performance rate.
Great, thank you. All right, and again, if you do have any questions, we will wait for them to come in. But at the moment, the question, or your final question asks, can you please clarify the intent of, oh, sorry, you just answered that with a repeat. So again, if you do have any questions, please feel free to submit them now. We will wait a few more minutes for any last minute questions to come in. All right, your next question asks regarding MH1, if a patient has a diagnosis of major depression between 11.1.17 and 10.31.18, but a diagnosis of bipolar was found in 2019, would the patient fall under the exclusion?
Hi, so this is Katie from the PIMS team. So for MH1, the denominator exclusions can be claimed until the end of the measure assessment period. So I believe Angie covered earlier how the measure assessment period is determined, and that's actually marked by the index date, which is the first instance of an elevated PHQ-9 or PHQ-9 greater, or excuse me, PHQ-9M greater than 9. That's also associated with a diagnosis of depression or dysthymia. So that marks the index date, which is the start of your measure assessment period. If the exclusion is within that 10 to 14 month window, it can be used. However, if it falls outside of that window, it's not applicable. So in this case, we would encourage you to take a look at your documentation to determine when that patient's true index date was. And if you need some more assistance with determining whether the exclusion applies to this patient or not, we'd encourage you to submit your question to qpp@cms.hhs.gov. Thank you.
Great, thank you. All right, your next question concerns Prov 13 and asks, if we have a patient with a discharge summary that lists TIA stroke as an admitting diagnosis, but does not include the spinal code as a discharging diagnosis, should we include or exclude the patient from denominator number 1?
This is Deb. My apologies. Medical record documentation. However, I would point you to page 6 of the Prov 13 measure. Go through the denominator criteria, each of the 3 options. My apologies. Go through each of those 3 options and then review the coding document to confirm whether or not that patient should be included in your denominator for the measure.
Okay, great, thank you. All right, your next question asks if a measure is paid for reporting in 2019 that the score has significantly improved when compared to 2018, will we get the point for quality improvement for that measure and domain?
This is Kristen. Go ahead, Oslo. No, if this is an ACO asking this question, pay for reporting measures are included in the quality improvement reward if there are rates to compare to in 2018. But to clarify, the calculation of the quality improvement reward for ACOs is a little more complicated than just getting the point. So I would suggest submitting this question though for a more detailed response. But the pay for reporting measures are included in the QI reward. Thank you.
Great, thank you for that. All right, and finally, can you just clarify a point that was made earlier where something was said where if you submit beyond the required patient volume, CMS will use all of the patients in determining the quality score. Is that correct?
Hi, this is Aslam. I can respond to this question. So all consecutively completed patients beyond the minimum reporting requirement will be included in the score calculation, as well as performance calculations. Thank you.
Great, thank you. All right, and it looks like that was the last of the questions that we have for today. So Runa, we will pass it back to you to conclude today's webinar. Thank you.
Thank you. Thank you all for joining us today. Once again, we are really sorry about all the technical difficulties. And as a reminder, the slide deck, recording, and transcript from today's call will be available on the QPP webinar library in the next 2 weeks. Our next support call is scheduled for next Wednesday, March 25th from 1 to 2 p.m. And during this call, we will cover frequently asked measure questions. Thank you so much for joining us today.